So lymphedema is a chronic type of swelling. Most people are familiar with the type of lymphedema that affects the arms or the legs in patients who have been treated for breast cancer or for genitourinary tract disease. When the arms become extremely swollen, women often wear garments that help reduce that swelling, etc. Lymphedema in the head and neck region is very similar, except its presentation and treatment are different. So these are people that after being diagnosed with a tumor that blocks the lymphatic drainage systems or radiation that causes a change in the ability of those little lymphatic vessels to move fluid, they become stiff and they have difficulty moving that fluid away from the head and neck begins to swell. People often experience lymphedema or swelling in the region of the neck, so they become very full, or they have what is referred to in lay person's term as a turkey waddle. And it can be very uncomfortable. It can be very unpleasing to look at. Many people experience swelling in the region of the face, so that their face becomes extremely moon-like. The eyelids, the tongue, the lips, etc. It is a hugely problematic disease for function. And we often disregard that. I mean, we often don't take into account that it's not only cosmetic that's the problem here, but it's also function. So people will complain, of course, of problems with cosmesis, the way they look, but they also will say, you know, I can't swallow well, I have trouble with my voice, it's hoarse. Breathing, there have been people who have had laryngectomies, a removal of the larynx where there's a hole in the neck, and they've ended up in emergency rooms, can't breathe, and nobody knew they had this because the swelling was so significant.